Rondebosch Medical Centre presents the best medicine, how to treat listeriosis. There's a lot of hysteria over listeriosis. In fact, there's hysteriosis. People are getting hysterical over processed meats. Get down! It's a Vienna! Even the politicians, we need depolonization now. Okay, let's get the facts for peace of mind. Listeriosis is a food poisoning condition caused by eating food contaminated by the bacteria Listeria Monocytogenes. That's the culprit right there, that microscopic booger-looking thing with the gross hairs flapping in the wind. Now this is important to note. Generally, healthy people can fight the infection on their own, and symptoms usually pass within a few weeks. They'll take care of it, no problem. But the infection is especially dangerous for pregnant women, babies, the elderly, and the immune compromised. Those at the extremes of age are at risk. Another troubling fact is that the incubation period of listeria, which is the time from exposure to infection, can range from 3 days to over 2 months. Wow, that narrows it down. So if I get exposed to listeria now by eating a contaminated quota, I might only get sick in the next financial quota. Really hectic. If you've been infected by listeria, you could have the following symptoms: fever, muscle aches, nausea, and diarrhea. If the infection spreads to the brain and nervous system, you could experience headache, stiff neck, confusion, and loss of balance. In South Africa, listeriosis was caused by Viennas, Poloni, Russians. No, not those Russians. They're not going, we the Russians are going to infect everyone with listeriosis. The Cold War may be over, but the cold meats war has only begun. No, not those. These Russians. Cold meats were to blame here, but listeria can be transmitted through many foods. Listeria is found in soil and water and is generally transmitted through direct contact, or what we call the fecal-oral route. Gross alert! Close your ears if you're squeamish. Fecal meaning feces and oral meaning mouth. Now I don't mean talking, SH1T. I mean carried by tiny specks of feces on the hands. It's not airborne. It can't be spread over Wi-Fi. You need a landline, a direct connection. So wash your hands. Establish good hygiene. If you're not washing your hands, you're gross. Vegetables can become contaminated from the soil. Animals can carry the bacteria and can contaminate meats and dairy products. Other processed foods such as soft cheeses can also be contaminated. Unpasteurized milk or foods made from unpasteurized milk can be contaminated. So wash your hands, wash the foods, check expiration dates, don't use the same cutting boards for meat and veggies, and wash the utensils thoroughly. Also remember, listeria is killed by heat. It can survive in the fridge, but generally you can cook the danger away. But still, who wants to take that chance? I'd be paranoid. My cooking is completely suited to this, but still I'd rather return it. All the stores will give you your money back. And remember, listeria can be treated, people. For adequate treatment, doctors will prescribe antibiotics along with fluids and medication for pain and fever. Dr. Shiraaz, Shaikjee, emergency head at RMC, says, please be cognizant of the fact that many people are infected by hysteriosis, not listeriosis. Listeria is everywhere: TV, radio, social media. We are all influenced by this. So because you have a headache and you ate a Vienna a fortnight ago, you think you have listeriosis because of the hysteria around the condition. That being said, check with your doctor if you're worried. If in doubt, get yourself checked out. Thanks for listening. Please leave any questions or comments below. Share if you can.